All right, Geodata for Health Work-A-Thon. My co-chair is not here, but I was planning to do this with Charles Schmidt from NIEHS. Um, Hopefully he'll announce himself if he's able to attend. Okay, so our roadmap. So we'll do this welcome and intro. I'm hoping to keep it to 10 minutes. And then we have the breakout session will be 65 minutes, or basically just the balance of time that we have left. And I'd like to give everyone like 5 to 10 minutes to prepare what they're going to say in the report back. And these report backs, I'm hoping, will be really quick. But I'll go over what I would like to see in those in a second. So, why are we here? What is the purpose of this cluster? I go over this every time that we have one of these sessions. More than 12 people around the world die every year because they live or work in unhealthy environments, and that's why we're doing this. And location defines your exposure to a lot of different things that can impact your health, like pollution, heat, floods, natural disasters, lots of different things. And so as a result, zip code can be a stronger indicator of heart disease than your genetic code. And climate change has exacerbated over 200 infectious diseases like Lyme disease and malaria. And so that's why it is very important for us to try and build bridges between geodata and public health data. So this cluster has identified some specific projects or activities to advance the linking of geodata and health data. And we're going to go over a few of those and hopefully make some good progress on them during this meeting. Um, okay, so the first proposed project was looking at integration with OMOP. So for those of you who don't know, OMOP is a clinical data standard. There's the OMOP common data model that's I'm not going to show you a diagram of it because it's very complex, but one of the new additions to this OMOP standard is the external exposure table. Um, and I'll show you that in a second. But the big question is that, like, you can have this external exposure table, but there's actually a lot of work that you have to do to go from, like, say, satellite measurements of temperature to a measurement of heat stress that would actually go into someone's electronic health record and be meaningful. And so, how do we capture that complex workflow in this way? And so, one thing that the NIH really likes is something called common data elements, or CDEs. And this is basically just a schema for a measurement to say, if you're going to measure blood pressure, this is how you need to do it, and this is the minimum metadata that you need to report with it. So is there a way that we can create the same sort of schema for environmental data to say, if you're going to have a measure of heat stress or a measure of temperature or whatever, like this is how you should do it, and this is how all the minimum metadata you should have represented around it. And so I was hoping that one of the breakout groups, we could look at heat stress as an example. And this example is important for a HIV and climate change use case that the Odyssey group, which is the group that develops OMOP, is using to kind of validate the workflow with this. And so the exact structure of the external exposure table has not yet been set in stone. And so we have the opportunity to give some feedback here. And you can see the exposure table has an exposure concept ID, an exposure metric concept ID. And so we can say the exposure concept ID is heat stress, and we can do this using an ontology term from an exposure ontology like ecto. But again, what what are you actually doing to measure heat stress? Like, that's the important part. How do you go from these global data sets to an actual measure of heat stress that's relevant for an individual person? And so where can we capture that workflow to go from one to the other? Another really important part of how Odyssey is doing this is they have something called the Gaia catalog, and that's just a data catalog. And the purpose of that is like reproducible science and transparency, so that if you're saying, I'm using this satellite data to calculate this exposure for this person, like they want the pointer to that data set to be in the catalog, and then you need someone else should be able to go from, step one, step two, step three to the exposure, and all that needs to be captured somewhere. It's not entirely clear where that should be captured. And so I'm thinking that an environmental common data element might be a good place to capture that. And so that's kind of what I'm hoping to talk through today. Here's an example of a common data element schema that I developed for biomedical or clinical measurements in humans, like blood pressure or cholesterol measurement. But I would like to kind of talk through using the Universal Thermal Climate Index as a measure of heat stress, as an example, for the HIV and climate change use case. If you go to this link, you'll see a GitHub repo with a couple of other schemas in there. This is using the LinkML modeling language. Um, Oh, that's not albumin in blood. That's just a measurement observation. So you can kind of see where I'm going with this. So can we sort of add more schema to this to include environmental CDEs and then make up an example for UTCI? So that's kind of what I was hoping to do in this breakout group. And I can sort of lead or facilitate that for anyone who's interested there. The other one that was proposed was the use of hex IDs as a spatial unit for integration and creating some sort of workflow for all of these like earth science data sets to be transformed so that they would fit onto some hex ID at some resolution. And so I think that's really interesting because health data often use these arbitrary spatial units like county or census tract. And the census tracts and blocks can be frustrating because they change over time. But using these hexagons, hex ID is like just a hexagonal grid over the earth, and I'll show you that in a little bit. Um, so the hex ID is more consistent and is being deployed in all of us, although it's not there yet. And can we create a workflow for NASA to create data products using the hex ID and just have that as one of their data products is, say, some measure of heat at hex 3, 4, or 5, or something of that nature? So what is this hex ID thing I keep talking about? There's a link that will take you to the homepage. It's a global system of hexagons with unique identifiers. So each of these hexagons has unique identifiers, but they've also got some really interesting API features that make working with them a lot easier. And so why hexagons? Well, you can kind of see here, I wanted to show that like a circle, sure, everything is sort of within the same distance, of the middle, but you also have all these dead spaces in between. The square eliminates the dead spaces, but then you get the corners are farther away than the sides, and the hexagon is kind of like a compromise between both of those two things. And so the hex ID, in addition to being a hexagon, you can also have it at different scale, different layers of resolution. So there's the hex 3 level, which is the level that the data products, so some data products were created based on parts of the environmental justice index at the hex 3 level, but they have not yet been released. So hex 3 is probably maybe a little coarser than what we would like. So hex 4, hex 5 would be nice. but there are some privacy concerns there. And so can we create some sort of a tool that takes NASA satellite data and creates a data product at hex 3, 4, or 5? So that's one option. So those are the only two that were proposed before the session. So if you have heard something that you want to work on, then that's great. But if you came here with something that you want to work on, now is the time to raise your hand. And I don't know, I'm going to stop sharing my screen so I can see other things here.
Anne, I
Yeah.
I started adding in some links to the session notes.
Okay.
So where it says like resources for this session, which is at the end of the page, I added in the link for Hex 3, the H3 schema, and
Oh,
then
great.
and a link to the UTCI user guide. And I don't have the link for the Odyssey Gaia data catalog, but I know that Tim Norris, who works on that one, he tends to put it into like this um, G disk, which or a copy of it in G disk. And so
Okay.
there's like something that represents like a data catalog of geospatial data. So the links should be on there.
Yep, I see him. Great, thank you. All right, so did anyone have anything, any other project ideas? Okay, that's fine to not. Let me get my slides back here. Okay, so does that mean that everyone here is okay with going to one of those two groups that I just mentioned, working on one of those two projects? Okay, excellent. Okay, so let me share my screen again and we'll go back to the slides. Okay.
And just a note, Charles has joined us, I see.
Okay, great. Hi, Charles. Charles is the co-chair for this session today.
Sorry about getting on late. I had technical issues with Zoom.
Yeah.
We don't like Zoom, unfortunately. Well, our IT doesn't like Zoom.
Yeah. Okay, so the first group was the OMOP and the environmental CDEs group. I can lead that one. I can facilitate that one. Does anybody want to facilitate the Hex ID and data product group? Was anyone planning to go to the Hex ID group?
I could go to either of them, and I could attempt to report back.
I mean, it's fine if we want to just have one group, just everybody work on one thing. If that's preferable. We might, get really far with one group.
I could do
Um,
either, but my preference is working with the CDE group and
okay.
maybe serialize it.
And I'm seeing a total of 9 participants right now, so that's not a lot of people to divide into 2 groups.
Yes, that's very true. So it is very tractable for us to all just stay in the one group and work on one thing. So that's perfectly fine. Let me go back to the slides and just say like the report back. I'm gonna try to watch the time and instead of like reporting back, um, let's just make sure that we've captured answers to all of these questions before the session ends. And let's maybe try to give ourselves 5 to 10 minutes to do that. Okay. So
And
now
should
for,
I pause the recording, you think, while we do this part of it, and then I can restart it?
I don't know. I don't think you have to pause the recording.
Okay.
Okay, let's figure out how we're going to dive in here. Mm, 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 mm. Okay, here's the, just so you can see what I'm working with here. Those are the schema that I created for clinical measurements that I will be using within Biodata Catalyst, which is a clinical research data, clinical data repository for like research data. It's not totally complete. These are just some examples. Um, I'm hoping to start creating some of these for things like environmental measurements. And so let's see. We can start with UTCI, and Jim has so nicely put in a link to,
I
yep,
brought
in the
it's
wrong one.
the UTCI user guide, and there's some kind of NetCDF metadata on there already, but I think take it further because some of it is just like multiple timestamps or that long representations. And I apologize for like this. You guys are hearing some type of background static from me, right?
A little, yeah.
It's
Kind
it's my fan.
Ah.
It's dying.
So maybe one thing that we can do to get started, is there anyone here from the National Microbiome Data Collective or whatever, NMDC? Maybe a good way to get started is to just kind of brainstorm a few of the different types of environmental measurements that we might be interested in, that we may want to create a CDE for. So when I created these LinkML schema for the clinical data, the first thing I did was think like, well, what different sort of categories did we have? So we've got measurements, measurement observations of the body. We've got people saying whether or not they have asthma or diabetes or whatever, people reporting whether or not they're taking specific drugs. Um, and so those are all like different clinical measurement types. So what might be some environmental data types? And I can already look at this like UTCI, that's an index. So that's one type, an index or a score. And I'm typing this into the session notes. And maybe someone who knows more about this than I do, like Jay, do you know this UTCI data set? Is that what would go into Gaia, the data catalog? And then it would just be like heat stress. The OMOP table would be heat stress, and then it would just point to the index data set in Gaia. It's not like the UTCI would have to be calculated like the data, or would the data sets that the UTCI is based on be in Gaia? And then we would have to capture that transformation.
I don't think so. I think like the work that Flavia's done with in Copernicus that pulls UT. They actually create the index, and you can pull the index for specific locations that you define, and so I think that's what would sort of end up as you know. Um, at some level of aggregation in the external exposure table. I mean, yeah, uh, yeah.
And I have a thought. I don't know how helpful this is, but I gather, oh, I'm new to OMOP, but I gather that there's sort of a fundamental concept of observations is part of it. Um, Similarly, coming from more of the environmental world, there's definitely a concept of environmental observations as kind
Mhm.
of a key driver. And so you can think about satellite data, ground-based data. They're all collecting observations, and then you can derive various products. Like it sounds like the UTCI based on observations and maybe some modeling that you're doing, on top of the observations. But it might help to think about, are there relevant standards for environmental observations that would be part of the mix for
Mhm.
this? And I think the answer is yes. Like, EPA and a number of other agencies have worked on broadly environmental observation standards. So it might be helpful to kind of take a look at what exists out there in that realm as part of the overall picture. I
Yeah,
just
those
wanted to,
standards would guide the aggregation and sort of, yeah. I mean, that's but there are sort of different standards like in the United States and Europe. But and you need to sort of think about both probably.
yeah, I did find, I wasn't aware of this, but there's someone put together kind of like a catalog of standards looking internationally. I can throw that into the resources section, but they actually have a dashboard where they say that you could kind of search the environmental data standards. So that looked kind of interesting, superficially.
But
So, yeah.
one thing to also think about in this, as was mentioned, there's the environmental measure, which is somewhat independent of people. And then there's the calculation of the environmental measure to an exposure, which is when you get into the dosing, the aggregation, the time period. And I don't know if it's helpful to deconstruct those into two separate pieces or to try to keep them together. But some exposures are going to be fairly simple. Like I live, in the area, so my exposure over the last month is basically whatever the environmental measure is at on average. But some, as we think, moving forward, as we hopefully get to higher precision environmental health, the exposures may be more modeled. So we may model that I only spend 4 hours a day outside. So my exposure is, has that component of modeling coming into it that may be arbitrarily complex.
Well, I think
Yeah,
that's the crux of it, right? Is going from the
Yep,
environmental measure to an exposure.
yep, yep.
and right now it's in the in Odyssey in the OMA in the GIS extension. They're taking a fairly simple view of joining
Right.
the person and the exposure through something called the location history of the person. But that location history could include um, the time at work and the time at home, and they could be different exposures. Um, and that's I think as far as Odyssey has gotten in thinking this issue through.
Yeah, I don't want to have the perfect be the enemy of the good there, and that you know this can certainly we can think about what's not there for the simpler models and maybe longer term how to do it more complex models.
So maybe one thing that would be useful is just we'll take something somewhat um, easy or something that strikes me as being easier than other things, like a measure of PM 2.5. So we've got these continental scale data sets for PM 2.5. Let's start there and kind of talk through how would we need to manipulate that data set? What would we need to know about that data set in order to come up with some sort of value, meaningful value for the individual? Like there would obviously need to be some sort of manipulation of the data, or a decision would need to be made based on the temporal window, right? Does that make sense?
Yeah, hands up.
So
Sorry, I'm not looking at the
Chen
Zoom.
Chen had his hand up before me.
Oh yeah, sorry. I can't. I was typing and not looking at the.
Eh, Thanks. I was wondering what if we use like air quality index or air quality life index? Is that, or am I misunderstanding?
No, that's fine. That's fine. So that's another index. I feel like that would be a different model, a different like meta model CDE schema for an index. We can do something else as an example. I'm just trying to think through because not everything will have an index. Um,
Actually, to add on that point, so looking at the paper for UTCI era, it seems like UTCI as an index score is calculated from like four different raw data measures. So those, um, I can just sort of read it out. So it's calculated from, I had it and then I lost it. Um, there's a time series involving, let's see, spatially gridded data, 2 meter air temperature, 2 meter dew point temperature, wind speed at 10 meters above ground level, and then solar radiation and thermal radiation. So it itself as a, I mean, the PM 2.5 and air quality exposure is, that's like a similar analogy where
mhm.
these ones have like raw empirical measures, somewhat, distance calibrated and time calibrated. But the UTCI era heat is itself an index, kind of like the air quality index.
Yeah.
Yeah. So there's a difference in interpretation. Right?
So if we go back to modeling indexes or scores, it sounds like, an index or a score is going to have it's going to be calculated from something.
Right.
So does UTCI, I'm not super familiar with it. What's the spatial unit that they just provide, or do they provide multiple spatial units?
It looks like it's 0.25 degrees, so about 31 kilometers.
Wow.
So it's quite large, but it's based off of hourly interval data.
That would
Hourly
be
interval data.
that'd be problematic when you have things like heat island effects, that
Yep.
coarse resolution.
So this as a data set is, I think the smallest unit I've ever seen was like 5 feet, 5 meter by 5 meter. This is thousands of orders of magnitude higher, so it's at this 31 kilometers. Maybe I would say maybe at the scale of a county or
Yeah.
you know,
So what's the temporal unit for UTCI?
hourly. Oh, wait a minute.
So I can get an hourly UTCI?
If you need to see where I'm getting my information, so I put the link into the chat for the Napoli et al. Paper, and I'm in section 2.1, which is their input file preparations. And so it says for each variable, an automated routine retrieves 12 hours data grid.
So that sounds like the temporal unit for the data sets that are being used to make the UTCI.
Right. They're hourly. It's hourly data. Sorry, raw data is hourly and 0.25 resolution. Once it's calculated,
Sorry for interrupting, but there is a 1 kilometer gridded data as well, if you want. I have used that before. It's also hourly. It's 22 years of data. And
for
yeah,
UTCI,
yeah.
Who's the provider for that, Cheyenne?
It's a team at TAMU. They used, again, ERA 5 and they downscaled it to using ML. So that's why they go finer.
Mm-hmm.
And I
Is it
think, yeah, sorry, go ahead.
is it global in coverage?
Yeah, it's global.
Mm.
The
Hmm.
only issue is that, if you want to go to hourly, because it's already based on ERA 5, which is a model, and which is reanalysis, but it's still not like very accurate, right? And then there is ML. People are kind of get
when you say
sometimes,
ML applied to it, do you mean it's a statistical downscaling?
yes,
Okay.
kind of. Yeah.
Okay. So they are interpolating it and going from like a statistical measure to like what could it be at a spine grid. Okay.
Yeah.
Could you possibly share a link for that?
Yeah, it's a comment to your comment.
Oh, it's a comment to my comment. Awesome. Okay. I'm gonna put that into our meeting notes, okay?
Of course. Yeah, because there has been like I have worked with the high mountain Asia region where they were trying to develop a vulnerability index across snow, climate, and air quality. So there, we had to I kind of upscaled this data to a monthly resolution to kind of see if there will be a heat stress or a cold stress in that region, because we would need river basin scale data, which is like 500 meters almost. But yeah, so that's why.
So here's what I'm thinking now. So we've got this index, this UTCI index. It's calculated from 4 different gridded data sets. It has a spatial unit, it has a temporal unit. Maybe there are multiple versions of UTCI, so there are multiple versions with different spatial or temporal units. That's fine. And then there are these 4 gridded data sets that are used to calculate the UTCI. And that sounds to me like a different environmental data schema. Each of these gridded data sets has a spatial unit and a temporal unit. It was created using some sort of instrument or model or both. It has an observation type, which would be like temperature, air temperature, or whatever. Um, and so then we have to, so we can say that UTCI is calculated from these other defined gridded data sets. But I wonder if there's transformation in there, how we might collect that or how we might capture that. Like, let's say the gridded data set.
So can I bring up one point there though? Because
Yeah.
I think that's you can chase down a rabbit hole with trying to capture the full provenance and transformations that are being done in a model, and those can get fairly complex. And at the end of the day, one of the questions is what really do we need to capture? Um, from and this is just my opinion from thinking about some of the work we're doing. If we have UTCI based measures in, say, All of Us or Biodata Catalyst, um, one of the primary issues is if I compare that to some other study, do I know that they're the same measures? And I don't think there's any way to do that through provenance tracking. I think it comes down to versioning of what the model is. The question as to whether 2 separate models or versions of the models are comparable is a pretty complex one that I don't think you can do through capturing metadata.
Okay, let me try to capture what you just said here in the notes.
I mean, to me, one of the focuses is if I have 2 different measures of heat and 2 different heat indexes calculated from 2 different systems, I at least want to know they're calculated using 2 different models. Whether or not I can compare them is a more complex issue. And frankly put, you'd have to go to the literature and say, are these comparable, and get an expert to weigh in. But at minimal, I want to know that All of Us is using UTCI version 3 and NC3 is using, some other person's heat index in version 4. And okay, I can't directly compare those, or I can coarsely compare them.
Mm-hmm. I would just add, I mean, this area of how do you track not only the provenance of the data, but the provenance of, I'll call it derived products. Like to me, UTCI is a derived product from data with models or algorithms applied in some manner. ESIP has done a lot of work, and this is a problem that crosses many domains, and so I only have a superficial awareness, but there there's a lot of expertise out there in the broader ESIP community about how do you deal with this problem. And certainly you have people using GitHub, and tracking workflows in GitHub, and okay, this is the workflow that I used, to create this product. Okay, well, I modified that, I forked it, and this is the workflow that I use for my product. So it's kind of a known problem where there's a lot, but I, like I said, I just have a very superficial, high level awareness that, there's a lot of ESIP folks out there who have a lot of expertise in this. It's not a novel problem.
Right. So, Charles, yeah, okay, I definitely take your point. So, this needs to be less about capturing the entire provenance, or at least that's a separate issue. We just need to be able to say, this is what this is in some
Yeah,
sort of
I'm not
standard way.
I'm
Like
not
that's the first
opposed to
step.
the yeah, I'm not opposed to trying to capture provenance and using that in meaningful ways. It's just it's a longer term challenge. Uh,
Yeah, yeah, yeah. So we're saying, all right, this measure of heat stress is UTCI. And it seems like any sort of measure like that is going to have a spatial unit and a temporal unit, and then some sort of observation type or a thing that it's measuring.
Yep.
Um, I'm gonna type into the chat. So some it sounds like across several of these items, just even understanding what the data is,
Hmm.
we need to have something defining the variable, and we can go into each of these into more detail. But the the data set that Cheyenne had put into the the paper that references the data set derivative from UTCI, let's just treat that as like a separate data set, right? It's a derivative of a derivative
Hmm.
because UTCI is itself a derivative.
Mm-hmm.
Um,
Yeah.
yeah. And then so there's a different spatial scale, different temporal, actually I think it's the same temporal element, but it's higher resolution, right? It's a model. Let's just say that's just different.
Hmm.
Yeah.
Hmm.
But what Steve was mentioning was that UTCI at the scale it was originally provided, the 31 kilometer scale, there's a limitation to interpreting that data for certain use cases. Yeah. And maybe that derivative of the derivative, glow UTCI, that one gets around it by being a finer scale. But that's I don't know if that's something that you want to be prescriptive of at the time of creating the data set. Like at what scale was this designed for and what is this not designed for? Probably not.
Well, that could be descriptive rather than prescriptive, right? Like,
Okay.
okay, here's what our thinking was when we did it. That doesn't mean you can't use it in a different way, but we want you to understand what our thought process was.
Yeah. Charles, were you saying something?
That's an interesting one to try to capture. I don't know how you do it because we are, one of the things we worry about is misuse of environmental data. People come in and going, gee, I found this nifty measure and it's not appropriate to use at the scale that your patient data is at or your population data is at. And
Yeah.
that would be nice to be able to convey because it's even if you go and read the paper, it's not obvious. Especially if you're not steeped in the geospatial aspects of the measures. Um, I don't know what is useful to convey there, but that seems a more that seems a valuable bit of information to try to capture and convey.
Okay.
Jarian has his hand up.
I wanted to mention that if you're going into derivative of derivatives, the original 2012 paper provides all the empirical coefficients that you apply on any temperature radiation data that you have. So if you want to use the 2020 paper that's based on reanalysis data, 25 kilometer, the 20 the more finer resolution is actually based on NOAA surface measurements all over the globe. So I would, if you need accuracy, I think that would have more accuracy because I mean, ERA is good at a coarser level, but as you go finer, uh, it doesn't work. So um, yeah, you can treat it as rather two branches rather than branch of branch.
So here's maybe a ridiculous question that's taking us back a little bit to the beginning, kind of. But let's say that you were going to dig up a file. You found, you were interested in some study about asthma and you had some PM 2.5, continental scaled PM 2.5 measurements. There's several, you're looking for a data set, there are several out there. What would you want to know about that data set in order to pick the one that will work for you? Like, what's the first questions that you ask about that?
While we're thinking about that, Jay has his hand up. He had it up before
Oh,
you
sorry.
post that, and but
I'm not seeing the Zoom. Yeah, go ahead, Jay, and then we'll.
yeah, Jay, you're muted if you're trying to talk.
Yeah, so let me find. So we were we were using the higher resolution um, uh, with for the city of Dakar in Senegal. But we had two sources. We had satellite data and we had ground sensor data. Um, and the satellite data and ground sensor data had different granularity. Um, and what was interesting about the ground sensor data is that we could characterize the locations in certain ways. For example, we could characterize the station as urban, suburban, para-urban, industrial background, and then say something about what that means, like with urban road traffic, human activities like commerce, heating and diesel generators, suburban, so forth and so on. So um, I think there are real limitations, when you're not at the right level or when you're at different levels of granularity, and there are different kinds of analyses you can do. I don't think we resolved this. Uh, we're using both sources, and we're trying to see what value each source has, downstream when we do uh, things like predictive analysis.
Mm-hmm. So yeah, I mean, I've seen this a lot in the context of modeling air quality and trying to predict air quality, and so lots of people are looking at okay, what can I do with the satellite data, but I don't want to ignore the ground-based data. So how do I work with them together intelligently? And so people are, they're building workflows to do the processing, and lots of people are doing the AI, deep learning, machine learning stuff to help them both kind of interpolate, to try to downscale, um, take advantage of the ground-based measures, but also take into account the satellite stuff and also predict. So and in some ways that an index like UTCI, you're sort of predicting heat stress based on your available data. Um, so to your question, and I would want to know, well, what were the data that were used? Right, pretty fundamental question. Um, uh, you
So,
know, I'm sorry, go ahead.
well, can you unpack that a little bit more? You mean like what data products were used, what data streams were used, or like what types of measurements were used? Like, are you trying to be really specific here?
I
I
I
Go ahead,
tried to,
Jim.
sorry, I tried to phrase it across what Jay just mentioned and what Steve just mentioned. Like, can you take a look at the chat? Like, it has something to do with a measurement or sort of algorithm. Is what kind of data is this, and has there been some type of comparison?
Yeah.
Jay, does
Yeah,
that
and
make
So
sense?
that's
I would drill even deeper and
Okay.
say I would like to have access to, let's say, satellite. Okay, it was a satellite measurement. Which satellite? What was the instrument? Ideally, if I wanted to, what are the characteristics of that actual instrument? That did the measurement, because there's lots of variation there, right? And the
Mhm.
NOAA and NASA people will say, did it go through calibration and validation? How reliable are the data? And then I would want to know what what was done with the data as a starting point. The data are a starting point, but then how were the data manipulated, processed, modeled, however you want to look at it? And I'd like to be able to, if I needed to, get down to the nitty gritty about that processing of the data.
Mhm.
Thinking about things like reproducibility. Well, how could I ever reproduce this if I don't have access to the details, the source code or equivalent? Um, and, and okay, I'll stop there for now.
I'm gonna say that was like reproducibility, right? The is this data junky, right? Or is there a way to be able to like recalculate generally?
So I agree with all the things that were just said. I would also add I want a link to a peer review paper to ensure that this has actually gone through a peer review, and had some feedback. And I that that's because I'm not the GIS expert, and I defer to the scientific process there. So, how well it did on comparison to the actual data, and whether it's been vetted are pretty critical ones to me.
Mm-hmm.
Um, and I do want to not lose. To me, this is kind of like the environmental data selection process. Which data do I want to use? Then, as it moves into OMOP, what do we drag along that then lets the user of the calculated exposures for that individual say, this is a measure of that I'm interested in, that I want to analyze. Because usually most of that data doesn't drag along. Like if I look at a blood analyte, I have no idea in a patient record how they actually measured it. Right. They're not going to drag along what lab equipment was used or what company was used for that. But we do want to drag along some of that metadata. And that's one of the questions too, is what would someone look for?
Yeah. Well, they're sort of like, okay, what should a schema for these types of data sets be? And then at some level, we want to then, once we've got that figured out, we want to then make some assertions like this is what these data sets should look like. This is what the values for these attributes should be in order for this data set to be applicable for public health.
Right.
Cheyenne, we're able to capture everything in the Zoom chat, right?
Yes.
Okay. All right, good.
I've been typing furiously. And there's some type of delay. So
Oh, funny.
did it go through? Nope, I did not click it. Yeah, and I've also copied that over to the meeting notes.
Oh yeah, this is good. This is good, Jim. I'm noticing we have a couple other people who haven't spoken up yet. So, and maybe you want to invite I see Smita. I'm sorry if I'm mispronouncing your name, and Brian as other folks who've joined this session in case they want to say anything.
I'm new to the area, so I'm trying to get the lay of the land, understand.
Fair enough. How about Brian? Bless you.
Yeah, I'm just lurking. I'm trying to learn how to do link ML for a different project, but I've also worked with some people at my institution that are looking at heat stress. They were did a proposal, it didn't get funded, and so I've just been kind of curious. I'm not. This may not be the most scientific explanation of my question, but one of the things I'm kind of wondering about is the UTCI, from what little I understand of it, just in the last few minutes, is that it's a reanalysis of data. I'm just kind of curious. You got different scales. There must be people that are trying to ground truth one against the other, or to interpolate to say, okay, these temperature readings on the ground are at one scale. This other kind of observation is at a different scale. Can those two be used to create smooth or smoother maps of what's really going on, based on, like somebody mentioned, heat islands? So if there's maybe a record of an area being a heat island, maybe you can't apply that to everything, but does that fit with the data from the past? And then can you use that with your observations at a finer level of detail, which, if you're talking about people in a neighborhood or people in a city, that's part of what it sounds like Anne is trying to do, is to kind of map what's going on in individual neighborhoods or cities or whatever, and what the impact is. Am I understanding that correctly? I could be way off.
No, I think that's essentially what we're doing. And what you said was interesting, because then it occurred to me that we could have a single like heat stress data set with different resolution in different places so that it's a finer scale in a place that does have lots of microenvironments.
Yeah.
But then in places that don't, you don't have to have as big of a data set to have capture the same variability.
Yeah, I mean, right. That's a really good point. That among other things, you can look at where are the people, where are the concentrations of people for one thing, and what's the land cover, which Jay was bringing up, I believe, without actually saying land cover. In my world, we talk about land cover, and so you could tell, okay, this is clearly an urban area or whatever. So yeah, we
And
also, I mean, when I was at EPA, we always, I won't say babbled, I almost said babbled, but we would talk about fitness for use of data, and so for one person, a set of data might be garbage, unfit for their intended use, but for someone else, the data might actually be useful for what they're trying to do. So, you can't automatically say garbage, great. The question of, well, what are you trying to do? Okay, well, these data
Yeah.
are appropriate for your intended use, but they're inappropriate for what the other person wants to do.
And I understand the conversation, or the kind of conversation, I guess, between provenance and QA, QC kinds of things. Maybe, I don't know if this works, but maybe another way to express it would be confidence levels. Or, maybe you have 3 different models and you say, okay, this is based totally on this. And this is another model that's based totally on this retroactive data. And this is a third one that combines the two. And so we've got, between the 2 available data sets we've got, this is our range. I'm just playing around in my head with, trying to get at what it sounds like Anne is looking at. The other thing, this is maybe way off track, but the other thing that really struck me when I was with this other group and we were talking about this was, how do you represent which people have air conditioning in their homes and which ones don't? Or, some other way in which they're able to mediate the effect of the high temperature. Just like when we were looking at smoke particle inhalation and what that effect would be on human health the last couple of years. I'm in the Midwest, and
Yeah.
it was pretty nasty here. And how do some people don't have a way to just stay indoors. Maybe they have to work outdoors. That was a confounding factor. I don't know if there's any answer to that, but it was just something I kind of got curious about. So
Well,
I'll
Jay's
stop
got his
there.
hand raised, and I think that he can also, in addition to what he wants to say, maybe comment on air conditioning data, because I think that's part of the data set that we're using for the HIV and climate change use case, isn't it?
Yeah. So a couple of things. Yeah, there are. I think the one way that we began to think about the issue you just raised is like, are there confounding factors? And there in the Odyssey GIS working group, there's someone whose sort of mission is the built environment. And so how do we capture the built environment alongside some of this other stuff when we're looking at, heat stress or PM 2.5 or things like that. The other thing I wanted to say was that, like Anne was saying, you could have different levels, different granularities in the same um, product that you're pointing to. Um, and one common way that happens when you use satellite data um, where your ground sensor data has missing values. And another use case for that is like when you want to do some kind of trend analysis and you want to look into the future, and you can't use the ground sensor data to that for that, but you can use with manipulation the satellite data. So you end up, with a series, a time series where things are mixed up. You have both, ground um, sensor data and satellite data in the same time series.
thinking out loud, in the meteorological world, they wrestle with a lot of these issues, right? Because they've got a tremendous number of satellite observations now that they're working with. They have a lot of ground-based data. They have a lot of gaps in the ground-based data. Um, and they're running models to try to forecast the weather. And in many cases now they're doing ensemble modeling where they're basically tweaking parameters and seeing if there's sort of a consensus looking across models. And if you're trying to, I'll say, predict UTCI, I'll bet that there's multiple models floating out there somewhere, and you could do, you know, look at what the various models say and see, well, okay, there seems to be a consensus, in this particular case for you know, what we're predicting the UTCI is, at this particular time and place. I don't know if that's helpful. And Brian raised his hand again.
I just, I don't know if we got time to get into this. I'm just curious if Anne, you're able to kind of share what this looks like in the model itself. You talked about CDEs and kind of incorporating them, and I'm kind of curious how that mechanistically how that actually works within a LinkML model. So that's probably a topic for different time and place, but I'm kind of curious about that part.
Well, I mean, that's kind of what I'm trying to figure out right now is how all this would get recorded in a LinkML model. Of course, I'm not sure if I understand your question, but I can show you.
I'm still a newbie to LinkML, so I'm
Okay, all right.
kind of getting it, but sometimes I get to things where I think, okay, I've been thinking about it as ontologies, but now I've got to also think about it as how you're incorporating other ways of representing knowledge, if you want to put it that way,
Yeah.
in the model itself. So it may, if that's too far afield, that's fine.
Well, so here's the way I'm thinking about a common data element, right? It's basically, right now, common data elements, if you go to the National Library of Medicine and look through them, they're not really very descriptive. It's just like blood pressure. Blood pressure measurement is a measurement of, blood pressure, and it maps to this Loink value, if you're lucky. And if you're lucky, there's also some free text saying what blood pressure is, and maybe that you need to have a medical professional take the measurement while the patient is sitting down, or yada, yada, yada. But I think that what I'm trying to do here with this is make this maybe a little more, make a schema for this thing. Because right now the biomedical common data elements are a little all over the place. There's lots of repositories. There's not really a standard for it. I think the CADSR repository is the best one as far as having a standard. And so what I tried to do here with what I'm showing you is say, okay, there are types of things, clinical measurements, that we're going to call a measurement observation. And it's basically just going to be this is a data structure with a key and value attribute representing a single observation. So this could be an observation of a blood pressure, an observation of a height or a weight, or some sort of measurement from a blood assay, or a urine assay, or something like that. And so every time you take one of these measurements, these are all the things that you need to include with it so that it makes sense and it's reusable and you have all the information that you need. Now, this is also very high level. You almost never get someone who's just taking a generic measurement. And so you see here where it says measurement observation is a CDE. If I wanted to make a CDE then for cholesterol, total cholesterol, it would be is a measurement observation. And then I would be a little more prescriptive with all these different, with the values that these different slots could have. Because, and maybe I would even add some more because you also, when you take someone's cholesterol, you also want to know, are you on lipid lowering medication? And did you fast before you took this measurement? And those are all things that you need to know. Um, so that's kind of what I'm trying to capture here in these biomedical examples. Or here's one for condition status, like when someone is reporting that they have a disease or a problem, these are all the things you need to know about it. Like what is the condition? How did it get diagnosed? How old were you when the condition started? How old were you when the condition ended? Stuff like that. So that's kind of what I'm trying to do for environmental data as well. Um, and now I've gone down a rabbit hole and I can't even remember what your original question was.
Well, this is good.
And
CDEs
so,
don't have a whole lot for environmental stuff. It's a lot mainly biomedical. And yeah, there are like multiple things that it's supposed to be standards, but it's it's kind of a mixed bag.
yeah,
So that helped me a lot. I appreciate it. I'm kind of low level here. You guys are
okay,
way
okay.
different level than what I'm trying to learn right now. So thanks.
And just to throw it out there, the CDE group that oversees the NIH CDE portal is fairly aware that we do not know how to deal with geospatial data at the time for its use data, and that what's in there is fairly simplistic and not well represented. So don't try to we don't want to try to fit to the CDE definitions that closely. They just don't do a good job with this kind of data.
Yeah, yeah, that's definitely true. I'm being kind of broad with my use of the term CDE.
Yeah, yes.
I kind of think of like everything's a CDE, any variable. But yeah, people have different philosophies on that. Okay, so we have less than 10 minutes. Maybe let's circle back and kind of fill in some of these questions that we had for the breakout. Da, 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 da.
I've moved all of my questions that were in the chat into that section that was like one or two sentences summary of what you accomplished.
Uh-huh. Oh
Um,
boy.
well, I should, that stuff can be moved to somewhere else because we spent the bulk of the time on this, and I think that's actually it's golden. Like this is a lot of information. Some of which you can ask, can a CDE answer some of these questions?
Mm-hmm.
Right. Or I would say for like what Cheyenne was saying, just understanding some of these data sets, it's commonplace in the descriptions, but it's buried in there. So if you extract it out, you usually have to have a person read it through. So
Yeah, I mean the goal with LinkML period is to make all of that implicit
yeah.
data explicit, right? Like there's all this stuff that's just in documentation that needs to be captured and represented much better.
Is there if everyone's is everyone looking at the agenda agenda page? I tried to answer that state your goal
Yeah.
question, but I sort of ended up with like three types of things that
Yeah.
we were trying to sort of muddle. We originally started looking at UTCI and then what do you understand about it? What do you wonder about it and whether it can be is this the best data set to be used? Right?
Mhm.
Sort of sounds like it. And then I think we circled back towards the common data elements segment, which is itself another, I think, a use case. So, but does that somewhat, these three or four bullets, like, does it somewhat capture what we were discussing, or did we miss anything as our high level goals?
I'm just going to add one more, but
Okay.
I think it covers it.
I think this is great what you've been doing, Jim. Phenomenal. Really helpful.
I'm a lurker too. So, but I added content. It's just you guys are talking through a lot of great ideas, so it's just worth even capturing verbatim.
Jim, one thing I'll throw out there, I still think it's worth thinking. I look at this from a very pragmatic point of view. We have a couple people in our group who are developing environmental exposure models.
Okay.
Like one of the people in our group is working on a heat island model. So I think about in terms of when we call their model to get exposure estimates, heat island estimates, what actually do we want as the output? Well, currently we get a CSV file and there's some metadata, but it's not really the right metadata to get it into an OMOP system. So we think about the output of the environmental model comes in some format, and does that format have all the information we want? And then we transform that output to an exposure model, which represents the impact of the people. And does the output that have the right information? And then what ultimately flows into a OMOP exposure table. And so there's kind of almost three transformations there for outputs. There's the output of the environmental model, the output of the exposure estimation, and then the actual incorporation into a OMOP record. And is that one linked ML file that describes the whole process? Is it two? And what information do we want during that flow? And I don't know, this is where I don't know OMOP well enough to know, is that one file and then OMOP handles the exposure into, the calculation of the exposures in its tables, or is that two separate steps that are done outside OMOP? So I don't technically know enough. I think conceptually there are those three steps. And one aspect question here is, are we focusing on all three, two of them, or one of them?
Um,
If that makes sense. It could be
no,
just
it's a
think
good
that
question. I don't know how many steps we've kind of covered because the vocabulary part is itself a capture, right? But then putting one giant um, triple score of all of this information together is just not particularly usable unless it can be teased apart. Um, but it's also I think I have views of it from multiple angles, so it definitely seems like you can get it all in one place and then you can sort it out, or you format your schema and you could do quality checks through that you would not be able to do if you had everything sort of scrambled. Yeah. Jay, what were you gonna say?
Just in answer to what Charles was asking. So the strategy with Odyssey and the GIS working group is for um, the um, the catalog. Um, there to be an interface that domain experts can use to create catalog entries. And that's all you really need to have to be able to do. You don't have to do anything else. There's a tool chain that takes a catalog entry and produces um, the the uh, uh, the the external exposure and or other tables that like that can support time series data on top of external exposures. And basically what Anne has been proposing and what we're wanting to accommodate is the use of CDEs, environmental CDEs, in the catalog itself. Um, so basically, you would you would sort of come up with uh, a representation of your data in in one of these environmental CDEs, and the magic sauce there, the magic is the link ML. I mean, I think we didn't start out using LinkML as the representation language, uh, but but this is the direction we'd like to go in, especially if if we're able to capture some of the knowledge you have, Charles, and put them into uh, these basically YAML. Um,
Yep.
kind of things. Yeah.
I I just wanted to mention I threw it into the document, but if you click on the link that I put in, I did a quick AI. The water quality monitoring domain, they've done a fair amount of work that I think is kind of adjacent to your CDE's thinking. So I I would suggest take a look at what they've done. It's specific to water quality monitoring, but they've I think it would be some good examples to think about environmental CDEs, more broadly, just to kind of see how they've gone about it, and what they've looked at. So I wanted to contribute that to the discussion. I know we're just crossing over time here, but
Yeah, yeah.
the only other thing I wanted to say was I think there's like one, I don't have it worked out in my head, but it's like there's one other layer in your LinkML thinking, like you've got sort of the most obvious core elements, and then it's kind of like other stuff where other stuff it could be decomposed into a whole lot of things depending on, what it is that you're measuring. But it might be helpful to just think about, well, what are the absolute core things that are universal? And then can there be a in addition to or other stuff thing that is more, you know, measurement specific, where you expand it out into the things that are like your examples about blood pressure, or cholesterol. Well, those are specific to those kinds of measurements. That's other stuff, the way I'm trying to start to think about it. And it's the same with environmental things. You've got your core things like what's the georeference, what's the time, right? Blah, blah, blah. And then you've got the other stuff, that's specific to, okay, water quality measurement. There's a bunch of chemical parameters, right? Typically, and, blah, blah.
Mm-hmm. Mm-hmm.
In the environmental world, they talk about methods. That's a big deal. What was the method used,
Right.
right? That's it.
Okay. All right. Thanks, everybody. We're at time. I think we got a lot done today. I have a lot to think about and to go over. Thank you for everyone for all of your help. And I'll see you around.